Welcome to yet another episode of Casted. This is actually our pandemic episode. We're recording in late fall 2020 in the middle of a global pandemic, the COVID-19 pandemic. The topic today relates to that very strongly. It's about the digital contact tracing. The example is the Danish mobile phone app for that called Smittestop, Infection Stop. And this is close to the kind of topic we like here at Casted because it's on the interplay of a highly non-trivial technical solution and some immediate repercussions for society. Our guest today is Mikkel Thorup. Mikkel is a professor at Copenhagen University in algorithms theory, easily one of the most respected researchers in algorithms, in particular about randomized algorithms, graph algorithms and many other results. He is here today in his capacity of actually advising the Danish government on the development of the application used in Denmark. Mikkel, welcome to the show.
Thank you very much, Thorup, and thank you for the introduction.
Yeah. So we are sitting here quite close to each other in a sofa in the middle of the analog bar at ITU. And the moment we sat down, by virtue of both of us having installed this program, our phones started sending messages to each other. Why and what does it do and how does this work?
This is a wonderful example of useful nonsense, in the sense that what the phones do is that they exchange nonsense. They send each other random codes.
Nonsense in the information theoretic sense, not in the Facebook sense.
No. So basically, your phone sends me a random code, which tells nothing about whom you are, and my phone sends you a random code, not telling you who I am. We know each other, but it's not the phones that know each other. But the phones both store this conversation of random codes. Now, if I one day end up test positive...
Say next week?
Yes, if that happened next week, not just within 14 days, then I would register that I have been infected with the phone, and then all the codes, I will basically have all the random nonsense, all the random codes I have been telling other people, they will get on a big aggregated list. Your phone will download the big aggregated list and say, on this list is one of the codes you heard.
On my phone, okay.
On your phone.
Right, so 1 week ago, my phone received the number 17. It's probably a much larger number. It's a large random number. And the aggregate list has now noted that this particular random number, 17, is associated with somebody infected.
Exactly. And it will come with some recommendations which are approved by the Danish Ministry of Health, which basically will say, you better get tested, you better be careful. It used to ask people to isolate, but the basic problem is that with these things, they're not perfect. And if you want to make sure you get notified if you've been close to somebody infected, there will also be some false positive. So in order to not make the burden too large, they first of all ask you to get tested as quickly as possible and be careful not to infect other people to find out if in fact you were infected.
Right.
And I think maybe just at this point, I want to make clear that the Danish solution is not unique to Denmark. We are using the Google Apple API, which a lot of countries are using, and this is also, it helps because this means that the app can be used across countries, so it can be used internationally. So part of my role was to advise using this app rather than using some of the solutions that have been tried, say, in Norway.
Yeah, can we go back in time? So this started when in March this year, March 2020, or when did the developments in Denmark start?
So the whole thing, I don't know exactly when they started. I know when I got involved.
Yeah, tell us
so basically, I have been writing about this in the newspapers earlier because I was very impressed with the Asian solutions where they did use this kind of electronic discoveries of who has been infected, and it's extremely powerful in Asia where they outperform Europe by factors of tens or even hundreds. If you look at the number of infected cases, it's really wonderful how little their societies are infected. So of course this has inspired different countries, including Norway, who developed their own Smittestop or something similar. But Their solution was based on locations, and it sort of, people felt that it gave up away too much information. It has in fact been deemed illegal, so they have stopped using it in Norway and asked people to deinstall it. So Smittestop is a way of people being able to find out if they've been close to someone infected without ever finding out who it is, especially without anybody else being able to see who it is. So the governments have absolutely no access to information. And this is the most important thing about their solution, because, or this solution, the Google Apple solution, right? So you just donate the random codes you told people if you test positive. And that gets on a big aggregated list. So we had before, I think you said the code 17 was the one I had told you. And I tell this big aggregated list that 17 is a code of somebody infected. And it gets on the big aggregated list where maybe it goes 5, 7, 12, 15, 17, 19, 23, and so on. And nobody will have any idea that the 17 is from me. Okay, so in that way, it doesn't give out any information. You just know that you heard 17. You don't even know you heard it from me. You just know that this was one of the codes that you heard the last 14 days, and you can't even get into your phone and find out. This is heavily protected. So you can say this is one of the advantages of having Google and Apple involved. They have actually worked hard to make sure that these numbers are carefully protected. And you can say if anybody had the power to find these things, they would basically be able to hack your phone, and they would not be interested in this. They would be much more interested in your bank account and everything else. So you can view this Smittestop as being of least interest and of least concerns among all the things that can go wrong. I mean, we have so much power in our phones to access bank accounts and everything like that. So finding out who has been close to whom is not a high priority for any hacker.
Mm-hmm. Okay, so I want to go back later to comparing these various approaches there are to implementing this. So in early spring, you had some articles in local newspapers basically evangelizing about the Asian solutions, which are not the solution we ended up adapting in Denmark. And then the government just contacted you, or how does this work?
I think basically the government was trying, I think via Netcompany, were trying to do something similar to the Norwegian solution. The problem they had in Norway, and I guess everywhere in the West, is that you insisted on it being volunteer to download it, and then people are worried about whether you can be, somebody can see what's going on. Or at least there are some very loud voices in the newspapers who worry a lot about these things, worry about privacy.
So maybe that's already useful as a distinction. So one family of solutions does the digital contact tracing on the basis of data collected, for instance, by cell phone masts, by various Wi-Fi routers and so on. There are lots of signals already in the public space that would be able and actually do track your cell phones, and that information could be made available to health authorities, and they could do all that tracking based on signals we already leave in the public sphere. If we don't want to do that, but instead want a solution that works on distributed individual phones talking to each other in a more or less anonymous way, then since we want people to opt in voluntarily into this process, these privacy issues become important because you need adaptation. You need people to actually install this for it to work. Compared to the other solution, where actually the mobile phone company doesn't really care about whether you opted in or out.
So there's sort of two sides to this thing that I'd like to discuss separately. Because one thing is we need precision. So knowing roughly where you are is not enough, right? So, I mean, one of the desires when it came to precision was to use the Bluetooth, which where you can actually simply look at the signal strength between two different phones, which is far more precise than trying to see where on planet Earth are you, where are you on planet Earth, where I on planet Earth, and based on that deduce how close we are to each other. That is probably not going to be nearly precise enough. And indeed,
and Bluetooth is already there. It's technology developed not far from here, by the way, 40 kilometers from here, that already informs phones about which other phones are close to them. So that's the technology we use to communicate with headphones, for instance, and other devices close to our phones. So it was already there by technological coincidence, I guess.
Yes.
So why not use that?
Well, so that's exactly what Google and Apple API are doing. It turned out that the Bluetooth, as it was from the outside perspective, couldn't really be used. Apple's Bluetooth fell asleep in an untimely fashion, so that you wouldn't actually discover that you are close to somebody else all the time unless it was used actively. But Apple does have control over their own Bluetooth, so they have been able to go down on the low level and make sure that they have a low energy version of Bluetooth that's always active. So having them involved was very important. And I would also just say that having such big companies involved in doing this low level thing, I think is a big advantage for how much we can trust the system, in the sense that we do have the whole world troubleshooting or finding the problems and helping hardening this Bluetooth Google API. So again, we should understand the whole difference between the API and the app. So the API...
Yeah, that's useful. So API, Application Programming Interface.
Yes.
Just a three-letter word for most people.
Exactly. So basically what the API does is it discovers these matches. And it will give you, as far as I remember, it's a vector of 7 different numbers that gives you different information about what the contact actually was.
And this piece of technology is built into the phone, whether you opt in or not. Right? This is part of the operating system of the two major phone vendors. So both Apple and Google have built into their operating systems, iOS and Android, this collection of small programs that, for instance, constantly informs other phones about whether they're close to them.
Exactly.
So that's already there, and it's part of the operating system.
And they have now also put this special API in, right? So APIs can be used for finding out where you are in the world and stuff like that. And this particular one is used to keep an eye on these kind of contacts so they can be reported if a match is found. Right, so it contains something about what was the duration, what was the intensity of the signal, all these different things. And based on that, the local app will judge whether the user should be informed. So this is a little bit like when you call your doctor and say, these are my contacts, is this contact serious, is this contact serious, should I notify this person or that person? The doctor will help you decide, should I react?
Right, so and let's just unpack that. So there's the API, which is part of the operating system, a family of small programs that are basically always on and do things whether you tell them to or not. And on top of that, developers can design and then users can install an application, now called an app, that uses this API for functionality. And the app is what we're talking about here.
Yes.
In Denmark, that's Smittestop, and there are similar apps in several other European countries. Germany has a big one.
Yes, and Belgium,
many other
countries. Norway is going to use a Danish app. Actually, they're getting it, and they even have already made it open source.
So this is interesting. So Norway started a different solution, not based on this operating system level family of protocols that interact by sending random numbers between phones, but they used something else, I guess, a location-based something?
So something with, and they basically found that it was conflicting with GDPR, so they basically had to ask people to deinstall it. And now they are following this new international solution. It should be said, Norway were way ahead of the time when they started doing this thing, and they were very successful containing Corona. I think most successful in Scandinavia and probably all of Europe, so they were doing an amazing job, but instead of doing it yourself, now we do things...
This kind of conversation are exactly what we like to have here, right? That technologically informed conversations about technology and changes to technology, both in reaction to available technology, but also in reaction to what the public adapts, or what governments support, or what can be financed, and so on. So this is great stuff. So Norway is in the process of moving to the Danish program.
Yeah, I think they're pretty much there. Not much is missing. And of course, this makes sense. But yeah, the whole thing about surveillance is, I think, a very interesting question, because we do have challenges in Denmark. We have very serious challenges convincing people to use the app. So at the moment it's roughly, I think, a third of the population, which is not, it's really not enough.
But it's huge.
It's very, very good, but basically, because you need the two people who meet to both have the app installed, on the average, if it's 1/3 of the population who have the app installed, it's only a 1 in 9 chance that a contact actually gets registered. And we would like the number to get much higher.
The efficiency of the solution increases with how many people have installed.
So the great thing is, it even increases with the square, which is good when you start having twice as many people installing it, you get 4 times as many notifications. And it's very important not to give up, in the sense that the app is like a little alarm that sets off if Corona comes. And like any alarm in the houses and stuff like that, you hope that it will never set off. That's the ideal situation. The more alarms, the more cases of contacts gets discovered. And the more we can succeed in stopping the spread of Corona, right? I mean, you have to think of every time you stop somebody infected. So what the app can do is to warn you early that you're infected, so you get tested and discover it before you infect other people. And every time we stop somebody from infected, well, we have a chance of stopping somebody from dying. So it's a plus. So just because we don't have a perfect solution, every time it catches someone, it's a very good thing. But I just want to return to this whole point of the surveillance thing, because I think it's very interesting also politically. As I said, the most important thing is that everybody should use it, and the whole difference between us and most Asian countries is that politically people do not want it to be mandatory. You can say in Asian country you can have it in the way it may not be mandatory, but you are not welcome anywhere without a green app. You can't enter the subway.
So just to make sure, green app just means that the app on your phone tells you that no infection has been registered for you.
So a green app means 2 things. First of all, it means your app is active. It's there, you have an app. And it means that you have not been exposed to anything. And in fact, I think it also works even more centralized. So if you have been in a place where they later discover infections, they can turn your app red or yellow. But so since you can't do anything, you're not welcome anywhere without a green app, there's a good reason to install it. And I think it's politically very interesting, because you could almost say that people could choose themselves. For example, we now have that all bars in Copenhagen closes at 10. And we have all these restrictions because Corona has spread like wildfire. And this is because of the people, because there's so many people who don't install the app. So it's the responsible people, or the people who don't install the app, that are the cause of all these problems we have, in the sense that they are not doing their share to stop the spread of Corona. One could imagine that everybody could choose themselves. Those who have the app could stay as long as they wanted with a green app, and those who did not have it could be sent home. So those who don't have it would have exactly the same world as they have now, but those who did opt in for the app, they could be given the freedom that they deserve, because they are helping stopping the spread. I know this is a crazy solution because it's too easy to cheat, but it's also very interesting. I find it's in some sense the dictatorship of the lazy, that they have the freedom to not install the app. And that's what forces my parents to be afraid of Corona, because it's so widespread. by not doing things, by not helping, you are actually endangering all our elderly people. Why should you have the freedom to put everybody at risk? If you want to put it most extreme, you could call it a kind of manslaughter when you do not help stopping the spread of corona. This is putting it very extreme.
Yeah, I'm not sure you're doing the argument any favor by calling it manslaughter. But one of the points, so this was the strongest argument for installing the app. There are several issues there that I want to unpack because it mentioned another core value. One is, of course, absence of death, which is a good thing. But the thing you mentioned here is also that one might argue that we can make more open societies if people subject themselves to this opt-in surveillance, right? So in your perspective, there are two solutions. One is all bars close anyway for everybody, or bars are selectively open for those who are willing to subject themselves to installing the app, to this self-surveillance.
Yeah. So at the moment we have a kind of collective punishment because not enough people opt in to help stopping the spread. Mm-hmm. And I think it's what I'm more trying to say is just it raises some very interesting political questions. Like, for example, at the moment in Denmark, it is mandatory to wear face masks, which is probably far less effective than installing the app. And the app...
Epidemiologically, from the perspective of reducing...
Yeah, I shouldn't actually say, I think both are very important, but the basic thing is just, we do make masks mandatory. Now we have an app which we have made sure cannot be used for surveillance. So we're basically just asking people to spend 5 minutes to install it on their phones. That we cannot make mandatory, and partly it would also be very difficult to do because there is no surveillance, so you can't see who is doing what. We can't see who has it on or anything like that. But
no, technically this should be easy, right? Technically it should be easy to force. The API is already there, so most of the technology is already on your phone. So technically it should be easy. It should also technically be easy to trace anybody whether they have the app installed or not, because we can trace people on their phone. A Google phone traces your movements anyway.
Yes.
And shares it with Google.
Yes, so we could trace these things. And indeed, that's what happens in... So again, I find the whole thing so interesting because we actually have people's lives at stake. And the solution in, for example, I hear people who have been visiting, I think, Taiwan and other places. The moment they shut down their phone, or shortly after, the police will turn up and say, you turned off your phone, right? Because they use this for the contact tracing. On the other hand, I also hear people who are extremely happy that they can go to Disneyland and everything is completely open. Mm-hmm. So the price you pay for a society without fear for death because of corona and stuff like that is that you have this app. But it's a very, very difficult thing. I can't even say what the solution is. No, now I'm luckily just a scientist and I just compare these different solutions. And I just want to say also, my role as an advisor has nothing to do with these political things we discuss here. I have mostly just been involved in explaining them within the general, objectives. How does this whole thing works with making sure that you cannot trace things? So even though I'm not even sure, I think it's the most important thing that you cannot survey. I have only been talking with them about why this thing cannot be surveyed, why it's safe, why nobody from outside can see who has been close to whom.
Right. So the solution you're advocating is actually enforces values that are much more narrow than your own. Right? I guess you've sort of two different hats. One is as Mikkel, as a concerned citizen about epidemic spread, and the other is your role as an advisor to the board. And is it fair to say that the solution you're advising the government has a more strict interpretation of the value of privacy than you yourself would have?
Yes, I'm one of these people who, for example, uses Google Map for traffic. I give away my where I drive and everything like that to Google App, so that they can help guiding me around traffic jams and stuff like that. And if I could give away my data the same way in order to be guided around Corona jams, I would happily use that personally, and I kind of would love to give that. But again, in our democracy, we do want this whole thing to be volunteer, and as long as we do want that, it's important that as many people as possible sign up for the app. And
even people who don't share your values, right? I guess that's
the whole point is, so I would rather have an app that as many people as possible use than have the most useful app. So that's the whole thing. So this is and this is why I have put aside my ideas for what I would like to do, and just think about how can we get most people want to use this app and feel safe to use it. But this has been very frustrating because a lot of media, have written about that there's surveillance, even though there's not. So in some sense, what happened here was people were scared of surveillance, and this is why we picked a solution making surveillance completely impossible. And still people are afraid.
Impossible. So I'm happy, certainly for the sake of this conversation, to sort of take the opposite role as somebody being much more paranoid about surveillance than I am about COVID-19. And I have the app installed. So from that perspective, it works, right? Because even I, who is probably maximally paranoid and has a pretty good technical background in understanding what's going on, I, after 1 or 2 sleepless nights, installed the app on my phone, right? Because I'm kind of convinced that among the many terrible solutions, this is the least bad. Right? So in that perspective, from that point of view, this was a success. Right? It is enough to convince people like me that comparing all these many terrible trade-offs to each other, which involve loss of open society, loss of freedom, loss of safety, death, infection, bars closing at 10, having to wear face masks, and all these things are complicated, I think, to navigate in. But as we sit here, your Smitterstop app and my Smitterstop app are happily exchanging numbers, as it should be. Yes. Right? And this exactly works because the solution that is implemented is this, I think, DP3 distributed privacy-preserving proximity tracing. Right? So, and I would enjoy us to sort of be quite precise about how that works and what it is and what it isn't. So maybe if we could pretend this is now one of those board meetings you attended. I guess you were the technical person there, or maybe there are 1 or 2 technical persons, and then I guess there are people with other concerns, and then you, hash this out over a beer, or how did this work? I'm genuinely curious about how this works. I guess it was online meetings.
Yes. So yes, everything was online except we had one reception at the time when Corona was least bad and when it was allowed, and where we actually got to see the other people, which was very nice. Yes. So first of all, the board had 5 people, 2 from the Council of Ethical Data Usage.
Yeah, Data 80 is called, right? Yeah.
Yes,
the Council of
and you can say their main role is to cry wolf every time they're worried about people's privacy. Mm-hmm. Then there was one who was in the business of security. So he is also saying data are very scary because I can help protecting you. So he has a business interest in making people scary. I'm not saying he did it in this case, not at all, but I'm just saying if you look at the interest groups, one is saying data is scary. The second says data is scary and I can save you. Mm-hmm. And then there were 2 computer scientists, one from the DTU and one from University of Copenhagen. And what data scientists mostly do is to say data is useful and data can help society. And in this case, we have that data can help preventing the spread of COVID-19. So that's an example of something extremely useful. because otherwise it can't spread like wildfire.
I have to put a pin on this here because this is really interesting. So these core values of different disciplines is something that I'm endlessly fascinated by. I think it's correct to say that data scientists, and one of the board members is a data scientist, a network scientist, right? I think it's correct to say that their value would be that data is useful, and more data is just more useful, and there's an arrow of technical, economical, and moral progress throughout civilization that is carried forth by more and more data. Mm-hmm. Computer science, on the other hand, also has these core values of anonymity, neutrality, accessibility, and transparency, and privacy. Right? So I think there's a strong tradition in computer science, one that I like a lot, that makes privacy an extremely important value. Maybe the IT security guy had that role. So I think the nerdy core values of computer science also include anonymity and privacy, and these values are contrasting with this other idea that we just need to be ultra transparent and just need to spread data in all directions.
Yes.
But maybe I'm wrong. I find
you're
this
absolutely right. So you can in some sense say that by having two computer scientists, they got even two more people who want to protect data. And indeed, a whole area of cryptography and sending safe messages is all a product of computer science. So indeed, we are aware of it. So we have multiple hats on. We want to play both games, both the one of trying to use data. I mean, for example, just looking at how people search on Google is the quickest way of discovering a new flu outbreak and stuff like that, much quicker than anything else. So yes, these are.
I guess this tension makes it. So I was interrupting you back to your board meeting story, bedtime story.
Yeah, and of course these board meetings wasn't that people were adhering to these rules. I just remember noticing this thing when I got called in the board that I was involved as this technical guy, and whereas the other people you can say had more of a political agenda. So I was basically just trying to say, how can we make most use of the data? How can we protect them? But I can say my role was maybe more as an expert than the others. But I think it was good they had us involved, and I think they really had this concern of getting something that people would use. I mean, that's clearly the biggest concern with a volunteer app. So the whole problem
I understand.
with something like this that is volunteer is that since you don't even check up if people use it, you can just see how few people were willing to use a face mask when it was just sort of suggested before it became mandatory. You only had a few percent using it. That's not really enough. So it's very hard for the individual. You get almost no benefit from using the app because since not everybody is using it, just because it doesn't tell you anything, it doesn't mean that you haven't been infected.
Okay, there is some symmetry with face masks here as well, and even vaccines, right? That the individual would actually benefit from everybody else using it, but
exactly.
But yourself, you're not incentivized. And this maybe goes back to this cultural difference that you also observed between Asia, where Asia is, as you know, a huge place with many different cultures and many different traditions, but there are more collectivist traditions in Asia. And whereas Europe has a stronger record for individualism. So maybe some of these measures that are built on voluntary participation have an easier time being adapted more or less automatically in
Well,
Asia.
I think in Asia it's implicitly forced because you better have a green app to go anywhere.
Yeah, then it's coerced, so it's not voluntary.
No. But for example, what would happen if we had an election? Right, so again, let's just assume the app works perfectly. So I'm telling you as a God-given that it takes 5 minutes to install. That's a whole investment. And if everybody around you used it, Corona would be gone. It is as good as gone. It will never be completely gone. People travel, there will be people coming now and then. So now people get to vote in the same way as in the American election. You vote between two different worlds. Now you get to vote. You can either vote for the world where everybody has to go home at 10 o'clock, where we get more than 1,000 infected every day. Everybody has to worry about everybody. People have to work from home. Our economy gets a very big hit. Asian economies beat the shit out of us because they're out having at full capacity now. China we see, whereas we're just going down. And we're crossing our fingers the vaccine come. If it doesn't, we're dire straight. If it turns out the corona manages to go around it, we're really in deep shit. So that's one world. And the other world, everybody has to spend 5 minutes installing an app. What would you vote for? Everybody, and if we even assume that it's true that nobody can see who has the app installed, except you can test that they have it. Well, whatever. I know I'm sort of saying some contradictions, but I'm basically talking about the choice between spending 5 minutes, having everybody else spend 5 minutes installing the app, and all these losses. We're talking about thousands of krones for every Dane. It's really a lot of money we are losing. So you have a choice between spending 5 minutes and getting a check of 10,000 crowns, or not doing it. I think most people would vote for spending 5 minutes each. I mean, spending 5 minutes is less than paying tax.
Yeah.
So I think it's very interesting. What's the limit of democracy? Could we have a vote on this? So we have a vote between the two different worlds. One where everybody spends 5 minutes installing an app.
I'm sufficiently cynical that I'm not even sure whether this requires a vote, because just the Danish law about epidemics is being rewritten right now, and apparently we are able to slaughter entire economies and small furry rodents with abandon without this requiring an election. We don't have direct democracy, so we can't ask these kinds of questions in Denmark, but good question. I don't know the answer to that, and it's of course also a question that will come up in connection with vaccines. Right? How far is the state allowed to go to strongly motivate people to take a vaccine?
Yeah, it's some very interesting times we live in. I think we are having some very tough choices, very difficult choices, very ethically, aesthetically, very challenging things.
Let me get back to the board meeting. Were there technical things that you actually had a chance to explain there, or is it basically just on your authority? You're saying this works and information theory exists and the chance of guessing a random prime is very small, or does it actually get down to technical issues in these meetings?
I think that I know that I many times during the meetings had to explain it, and especially the other professor kept saying, just listen to Mikkel when it came to explaining how these different things were. Of course, he also knew it very well, but it's very surprising that it is possible to have a solution that is privacy preserving. It's not at all an obvious solution if you just hear about the problem in the first place. How can you make sure that the phones discover who has been close to whom without having some central database somewhere that keeps track of people? How can this be possible? So even explain it, because it's so beautiful. Like many solutions we have are based on cryptography. You try to hide things by layers of different keys and stuff like that. But here's the solution is so simple. The only time, so we have all this information that just gets stored in the conversations. That just happens locally on the phones. In principle, somebody could have put up devices at every square meter of Denmark to check these conversations. But this would be a huge investment and not worth anything. And especially no foreign power can do that.
Oh, you're
okay.
I see.
Stuff like that. So,
but the devices exist, right? Mobile phone, cell phone masts do exactly this, recording the proximity of phones already. So the proximity of phones is recorded already and sent back to Google, I guess, and your phone company knows it.
They don't know all the Bluetooth stuff.
No, they don't know the Bluetooth stuff, they know the Wi-Fi stuff. So there's a difference in protocol, but I don't think there's a difference in, what should we call this, surveillance of ethics.
No.
It should.
So this is completed. So this app is just working on this Bluetooth thing, which is just this local information between users. We just store it locally. Nobody from the outside hear anything about it for now.
We now being the users, Thorup and Mikkel, our phones store this locally on the phone.
And nobody from outside hear about it. right? And then you have this thing that if you get tested, that's the first time you give away any information. If you get test positive, that's the first time that any information is given away.
Yeah, let's play this out. I go to the health authorities, I take a corona test, it comes up positive. Now what happens?
Now you tell all the codes that you told others, you tell that to the big aggregated list.
I guess I have to do something on the phone, right? I actually click a button, say, I am now tested positive. I identify myself to my phone again, I guess?
Yes.
Right? This is easy in Denmark because everybody, there is already a third-party authentication protocol in Denmark that is used for internet banking, for instance, as well.
Yeah.
That everybody has and trusts. So I reconfirm to my phone that I am who I am and tell my phone that, yes, I have just tested positive for corona.
Yes.
This is a choice I have, but let's assume that I do that as a good citizen. Now the phone does what?
Then the phone basically uploads all these codes to the big aggregated list.
Including the number 17 that you sent to my phone last week.
No, exactly not. It only, if it's you who got infected. Oh, I forgot whom you said was infected.
I don't know. Let's pretend I'm infected now.
No, let's pretend it's me. Because it was me who sent the code 17. Then I would send the code 17 to the big list. If you got infected, even though you heard me tell you 17, you do not tell 17 to the big aggregate list.
That was very clear.
Because the important thing is, it's only the things you have told others you tell to the big list. So as long as I don't get infected or anything like that, no information about me will ever be revealed to anyone outside, except that you locally heard I told you at 17.
Mm-hmm.
So this is basically it. So the only information is the random codes you told people that you upload if you get infected. But that is a volunteer choice.
Right,
if you want to upload
I'm not
that.
even telling the system that I am infected. I'm just telling the system my random numbers.
Well, you have to identify yourself.
Right. I did identify myself.
And this
to
is
get
extremely
access.
important because they're very, very afraid that people will spam this with a lot of infected codes, so that everybody stay home and our economy goes down, right? So.
That's
so it has been
Blofeld like James Bond attack on the economy. Yes,
so basically, we have to make sure that those who upload the infected codes really are correctly infected.
Good.
Yes.
So infected Mikkel told the system Mikkel is infected. The random numbers that Mikkel has sent out, for instance the number 17, which Thorup received, which I received, is now flagged as the number sent out by somebody who was infected. And now my phone regularly asks the database, please send me the numbers of infected.
Yeah, so basically you download the list ever so often, and last I heard about the numbers, it was something like once every 6 hours. That may change. It doesn't really matter. You basically just, it doesn't matter that you on the minute know that 12 days ago you are close to somebody infected.
So one more important question. I think I know the answer, but just let me ask it. Does my phone remember I saw 17 and 17 is now infected? Or does it remember I saw 17, I got it from Mikkel and 17 is now infected?
So it only knows that you saw 17, and you can't even actually see when the infected number, you can't on your phone see when that number came from. So you can't even say it trace it to a certain meeting. This is again a privacy concern.
Right. So it's just the number 17. I can't see when I saw the 17. I can't say where. I can't see who I got the 17 from. All I know now is that in the last 14 days I've been close to somebody who sent me this random number 17, and 17 is now on the list of infected numbers.
Yes, and here it's sort of the involvement of Google, Apple API, which we basically view as a black box. CIA can't hack Apple, and certainly the Danish government can't hack Apple. So we are basically stuck with the information that Apple releases, and the same with Google Android. So the only information the Danish authorities have, or that sort of comes out, is the information that, yes, 17 was a match, not where and when.
Tell me why I should put more trust into an international private company than into my public health authority. I guess it's a technical issue, right? I actually trust Apple to do this very well, but why should I trust Apple to not lie to me?
So here I think you have to look at interests. Apple already has unlimited access to far more important information than this thing here. You have at least many of us have an Apple Wallet, where you can use that to run your credit card. People have mobile pay, have all kinds of things.
This is a good example of something that I don't use because I'm maximally paranoid about these things.
Okay, so basically, so here's the deal. The app runs, the whole idea in the app, rather than having give everybody a bracelet, like in Singapore, I think they use the bracelets that used to be used for prisoners to give to people who entered the country to make sure they didn't run away from their hotels and infected other people.
And the bracelet has a device in it?
Yeah, that's an electronic device, so they can basically trace where you are, right? So what I'm just saying, we could imagine one extreme solution, which was that we developed a piece of hardware, a bracelet, something like that everybody was forced to wear. I could not imagine such a society, but something like that could be possible.
I read science fiction, I can easily imagine that.
I can easily imagine, yes. But here instead, the idea was to run on devices that most people already have and trust. So basically, and this is a sufficiently large percentage of the population that it would work without having to buy things for everyone. I mean, the alternative would have that everybody got a little device to keep in their pockets.
Right. Okay,
so
now I understand. So this is a design parameter, because the alternative would have been to make a bracelet maybe in red, white Danish colors with the Little Mermaid on it or something that people trust. But the question is, would more than 30% of the population use that instead of the phone?
Yeah,
so it's a real question about predicting what kind of electronic device will people adapt and trust more.
Yeah. So here the basic idea is to make an app that runs on devices that people already use and trust. And in this connection, you are having if it's an Apple, you're having an iPhone, then the iPhone is run by Apple. It offers a variety of APIs, something that can find locations, something that can maintain which matches and stuff like that. And now the question is, do you want to make an app that uses the things that are available from Apple via these APIs, right? And basically all the Danish authorities can do is to use the Apple iPhone as a black box. This is this computer science terminology, something we can't see what's inside. You just know it offers a certain functionality. So Apple offers this functionality, and we can use it or not. Mm-hmm. And this functionality requires that you have your Bluetooth running, and some people refuse to do that. Some people say it's worth it, but again, we are trying to run on something that many people have, and we also have problems with old phones that don't run this feature. And actually one reason they don't do it is because the old Bluetooth wasn't safe enough, right? So basically the API, you can't run the API, they actually make sure you have an updated version of Bluetooth, which is considered safe. And what does considered safe mean? It means nobody knows how to break it. At least Apple and those guys don't know how to have it. Mm-hmm. So it's only if you have an upgraded version of this whole stuff that you get to run it. But so again, you trust Apple. It's only for people who trust their phone that you can use this thing.
And the argument then is, clearly there are enough people who already trust their phone to routinely collect data about them and share them left and right.
Yes.
That these people may also be incentivized to install a tracing app that does less than your phone already does.
Yes, exactly.
Yeah, that was maybe a cynical way of putting it, but I want to just hammer home the point. The location data on your phone is collected, stored, and communicated anyway. Right? If you have a Google phone, then you can ask Google, and Google will tell you exactly where you've been the last 2 weeks. And that information is shared with not the Danish health authorities, but with vendors of plush toys and sports shoes.
Yeah, and I would have been happy to try to use these data. I mean, Yeah, you use it for Pokemon, you use it for when you're running apps, all these different
things. A running
things.
app is already a tracking device, and the running app could quickly be changed into a proximity tracing device.
It would work perfectly.
It would work perfectly, but the question is, would people trust using it? So it's this interesting, I guess, trade-off.
So I think a reason why many people are more worried about these things is because there's some very loud people in the media who worry about it. What I'm just saying is most people are not afraid of letting Google use the apps to maintain location or Momondo and stuff like that.
Well, most people also dislike it, but the dislike is not translated into behavioral change. Right? There is this trade-off between convenience and safety on one side and principled stances towards surveillance on the other side, and most people are in cognitive dissonance about this, right?
So here it is, we have this very interesting problem that when you share your location with your Google map, then you get a direct advantage. You have this incentive that you find out that you avoid traffic jams. If you share your location data with Momondo, it helps you calculate how fast you run, all this kind of stuff. You
or
get a
in my case,
advantage.
how slow I run.
It could be, but whatever it is, you get a direct advantage. The big frustrating problem with this thing here is that with the Corona app, Smittestop, it only matters that everybody else install it. You have no personal incentive. So you would like to pay everybody else to do it, but you'd rather not do it yourself.
It's a collective advantage.
It's a collective advantage and zero advantage for yourself. And I think this is what makes it technically very, very difficult to deal with. There is no incentive for the individuals. This is why I'm kind of suggesting pay 1,000 crowns for everybody who install it. Do something, because this is the value for society. It has a huge value for society that the individual, everybody installs it. Not the individual, but that everybody installs it.
Yeah, or just 10% more, right? And any increase in number of people who install the app gives an increase in reduced infection.
Exactly. Yeah. So basically, you can say you're almost working for society. Your phone is working for society when you install this app. And the society would save a ton of money to pay people to install it if that meant that more people installed it. In order to say that you should get some of the benefit for society from installing it, otherwise I don't see how to get people to do it. I just don't see how to do it if we don't do something. At the moment they have zero interest doing it themselves. They only have interest in other people. How do you resolve this problem?
The state is a powerful beast that can force people to do many things. Right now we try to.
But you could also incentivize
not
it.
do that. Yeah.
But how? But the question is then, if it has to be voluntarily, can we incentivize it? Because it doesn't have its own incentives. That's what we discussed before with the Google solution, the Google traffic. It has its own incentive. The Momondo has its own incentive.
The individual incentive.
Individual incentive. Yeah. Here there is no individual incentive. How about creating it? How can we create an individual incentive so that it reflects the societal value of people installing it? I don't see anything wrong. If all taxpayers can save 10,000 crowns if everybody installed it, why not pay 1,000 crowns to everybody who does install it? Then everybody would save 9,000 crowns. And in fact, the people who install it would get the last 1,000 as well.
Okay.
So can we incentivize it?
I think you're making this point very well. I'm very much on the other side, but I think this is the strongest point that you can make for this this idea that a surveillance increasing application that does not have an individual immediate positive effect for the individual should be incentivized by other means rather than government coercion, because government coercion is still on the table. The government could just say, we're doing it like this, full stop. We are using the danger of an epidemic infection of a pandemic is so big that instead of trying to play games with incentivizing people to install apps on their phone, we just mandate by government that people's movements in the public sphere are going to be tracked, full stop. If we can kill 18 million minks, we can do that.
Yeah, so if we talk about incentive, it's well used in connection with fertilizers in Denmark, right? There we tax things, that's sort of anti-incentive, right? Where again we try to play with the incentives by putting something artificial. This is sort of like a negative tax. You actually get money back because you save the society for a ton of money if you install this app. So we reward the behavior that helps society the most.
I get it. Yeah.
Instead of punishing
Yeah.
what doesn't help.
There's a huge conversation which we only sort of opened the door to, which are the long-term consequences of getting people used to self-survey in order to build the good society, something that I strongly dislike. But this is not the right conversation to have that in. Hopefully you can have that in a later conversation. I want to just now go one step. One way of understanding what a digital technology does is to see what it replaces. And so contact tracing, so we're talking about digital contact tracing. Contact tracing already exists, has existed for decades, and is a completely non-digital process. So pandemics happen all the time, and one of the big, I guess, breakthroughs of the 20th century is that we got rid of smallpox, basically by just deciding it. So a random guy in Russia said, let's get rid of smallpox, and then everybody said, yeah, let's do that. And 20 years later or so, it was gone. And combating a pandemic requires many, many different approaches, and one of the pillars of disease control is indeed contact tracing, which is done and has been routinely done for decades in all kinds of pandemics. So smallpox is eradicated by doing this personal individual contact tracing with a nurse or some other health official contacting you and asking you to tell where you were. So, as soon as we found an infected individual, there are established protocols all over the world using human-to-human contact, 2-hour interviews with a piece of paper or a whiteboard, where the individual relates where they've been the last week or 2 weeks, depends on the pandemic parameters, of course. And this is in some sense what we are automating, or part of it which we're automating. And there's something about also close friends and far friends. Can you tell a bit about that? Because it doesn't replace in the entire process, it replaces some of the process about close contacts and far contacts, right? I guess the people in your family, we are still tracing by traditional means.
Yes.
Even for the COVID-19 pandemic.
Yeah, no, so again, I am not saying that Smittestop replaces traditional contact tracing. Traditional contact tracing is superior when it comes to clusters.
Sure.
Clusters, sort of people who know each other, families, work cluster and stuff like that. If you know who is around and you know the circumstances of the contact, then it's far more effective than anything we can do based on signal strength and duration and stuff like that.
And let's just hammer home that point. We are already doing this. We've done this for decades. Everybody is doing this, right?
Yeah.
If you get sick, then you will have this conversation with a health worker, talking about your family, co-workers, everybody you remember.
Yeah. And I'm also hoping that the whole testing thing will become more and more seamless, easy, because then we can spread the net and we can say even more people should be tested just in case, because this, whether you infect someone or not, can be a little bit unpredictable, also because we have these super spreaders and all this kind of stuff. But what I want to say here is, yes, majority of transmissions happens within clusters that know each other. The vast majority. Most people get infected by a family member or something like that. But if it just stayed within families, it would never spread beyond the first family who got it.
Because it's easily identified and easy to isolate.
Yeah, it would just stay within the family. But it doesn't stay within one family. The dangerous transmissions are those that happen between clusters. Without jumping between clusters, it would never be a problem. So these are the dangerous ones. These are the ones who are hard to trace and the ones that are impossible for traditional contact tracing.
Okay, let's just hammer. So cluster is what you and I would talk some kind of clique. It's a small
group that know each other.
A small, highly connected part in the social network.
Yeah,
social
and
network
which,
in the broad sense.
And of course, it transmits very easily within people who sleep together or eat dinners together and stuff like that. We can't stop that transmission, but that's also not a big problem. I mean, of course, it's a problem. The whole family gets sick.
For the individual, it's a problem, but it's not a problem for spreading the pandemic.
No, but but what makes the pandemic dangerous is that it jumps between clusters. That it jumps between contacts that do not know each other, and this is where Smittestop has an advantage, that it can help catch these cases where you are close to someone you don't know, that you sit with in the bus or something like that.
Because these are normally not well caught by the standard traditional contact tracing mechanism.
And that's why it's so important. Yeah. So, and that's why we need it, but that's also why you shouldn't look at the number of things it catches. So, of course, within families, it should catch those. And it's embarrassing if it doesn't catch them, but that's not the important ones. It's these random contacts that are extremely important to catch, and the more you catch of those, the better. That's where you find the missing links in the spread, if we think about contact tracing. Yeah.
Excellent. Did we cover everything? Is there more you want off your chest? Because I think we did get quite far with the technical part and what it does epidemiologically, and we opened the door to the socio-technical aspects as well. Are there more meetings in the board, or is it just done now?
There will be more meetings, I'm pretty sure. There
are
things
the
to discuss.
app continues to be under development, or how does this work?
There will be a new solicitation for further developments, and it will be hardened. I'm not involved in implementing the app or coding it. There's a company involved, and bugs are found like with any other software. I can say the most important thing is that people don't deinstall it just because there's a mistake. You don't want to have people start from scratch, and I hope they will always upgrade so they get the latest new.
Well, this is true for all software.
Yeah, and of course it's also going to be upgraded with medical information, right? I mean, these are sort of, how do we interpret this thing? So again, remember, the Google Apple API, they give you these 7 numbers that characterizes the contact. Is this a serious contact or is it not? They have discovered with super spreaders that they can transmit much further, so maybe everybody within 2 meters should be notified and told to get tested. There keeps being changes like that.
So a super spreader is an identified individual who spreads a lot during a very brief moment of time?
I'm just talking about the thing that's described in the newspapers, right? That it appears that it's not at all predictable how much you transmit the disease. I can say one of my friends, his daughter's boyfriend had the disease. They lived together, and still, even though she was with him in all the most dangerous days, she never contracted the disease. So some people don't spread at all, or at least some people don't receive the disease at all. She has tested multiple times, she never got it. And then you have these cases where one individual can infect, I think the record is something like 130. I don't think people should try to break the record in seeing how many they can transmit, but it seems like that you can transmit to 100 people in a day if you're one of the infectious guys. And of course, if you manage to find some closed room and stuff like that and shout a lot, then that gives more bonus points. Or I should say negative bonus points.
I mean, I'm a singer. For me, this is terrible. I mean, choir rehearsals have been cancelled, and it's terrible for me. But these are. So
we keep getting information about how we want to change things. So that's also why it's important. It's always updated so that you have the latest information in to interpret these different things.
Excellent. So where was it on the communicating with even other academics or the public about technically and in particularly socio-technically different things is both extremely frustrating and also extremely what should we call this, satisfying, right? Because you can make a change. So where was this on the balance? Is it more frustrating than satisfying?
I think it was actually very satisfying because so it was academically satisfying that they wanted me to help them find out what it meant to be privacy preserving.
Right.
Even though I am not sure I prefer privacy over the disease. But anyhow, so technically it was very interesting to be involved in this thing. And they were really listening. And they were really listening to advices. They basically told us up front that if we didn't approve of the overall design, they wouldn't put out the app. I mean, it was this strong. We really actually had some power. One of the satisfying things is that we pushed for open source. And while it's not open source yet, it's part of the solicitation, so it's part of the contract for the next version. So this was one of the key wins, and I think this will also help finding possible errors in it. So yes, they have listened to what we have said, and it has been very interesting to work with these people. These are people who really care about it. My big frustration right now is that only a third of the population has adapted it. And again, it is the easiest of all weapons against corona, 5-minute installation time, and for most people that will be it. So the problem we have is when people get drunk, they forget about distance. But the phone doesn't get drunk. As long as you don't drop your phone somewhere and you just have it with you, the phone will tell you if you got into trouble later. And it's not that it's going to tell you off, it's just saying, sorry, you've been close to an infected, right? So this is, I think, the perfect thing if we can get, in particularly the young people, to use it. It may be difficult to prevent them from getting close to each other, that happens, but if at least they have the app, then they could get notified if they had been close to someone infected and be told, now it's not the time to hug your grandparents, stay low, get tested before you see them. Yes.
Thank you very much. I know from personal experience with you that young people are not the only people to get drunk.
True.
But
yes.
So I hope we will get back there sooner or later. Thank you very much for coming, Mikkel. This was super interesting.
Thank you.
And
it's a pleasure.
Thank you all for listening.